You are strategically located in some communities that are really underserved. And these are people that have challenges in terms of keeping up with their care programs and identifying the best, really matching the best opportunities to receive the best care. So to talk a little bit about the partnership with Docent and what you guys are doing.
Yes, and I'll definitely hand it over to Royal as well to talk a little bit more about the great work that Docent has been doing and the program that they've put together. So I joined CommonSpirit a few months ago as the new System Vice President for Population Health Innovation and Policy. In that role, had the amazing opportunity to learn more about Docent and initially become the medical director for that program and our partnership with them. So I'm a practicing family medicine doctor. I come from the academic side. So I'm one of those old holdouts that was still doing inpatient medicine as well as outpatient medicine and still providing maternity care. And so, again, when I heard about this amazing program and what they were doing, particularly in the space of maternity care, I was extremely excited. So our partnership with Docent really focuses on helping our patients navigate through certain episodes of care. And so, again, specifically looking at the maternity care journey as well as the orthopedic journey. And what we found in our initial pilot was that we saw some significant health outcomes that was maybe a little bit surprising to some, but not all. And some of those health outcomes, given the population that we serve, as you mentioned, we serve a very large Medicare and Medicaid population, one of the largest providers of Medicaid in the country, actually. And what we saw was still these significant outcomes, even in the Medicaid and Medicare population, which often are a little bit more challenging to help them navigate through their care. So we saw about a 37% reduction in preterm births. In that population, we saw a pretty significant reduction, about 70% in readmissions. And we also saw a pretty significant reduction in length of stay for both our maternity care patients and our orthopedic patients, which meant that we were able to get patients home sooner, rehabbing and healing in their environment, which oftentimes is better than being in a hospital setting. So some pretty significant outcomes that we saw in clinical outcomes. And because of that, one of the things I have said about healthcare is there are times when we have evidence-based practices. We know there are things that work, but for some reason we don't standardize that across our systems. And so here was a program that we saw pretty significant outcomes. And so we said, well, wait a minute, why shouldn't every patient that we serve in this space have the ability to access this amazing program? And so that's what we launched into now, this second wave, if you will, to really expand this amazing program across all of our facilities.